So you just received your orthotics. You're on your way to healing. The purpose of wearing your orthotics is to put the lower jaw in a more ideal position, which allows for the joints and the muscles to function properly. It's going to be a little difficult at first. Usually the first couple of weeks are the worst. If you can get through that period of time, it's going to be much better. But it is going to be an adjustment. You're going to be learning how to eat, how to talk, and just overall having something in your mouth all the time. It is uncomfortable, but it will get better. But you do have to wear them. There is no reason for you to take them out. You should have them in all the time other than to brush your teeth or to change the night and the day orthotics. So some of the things to expect is you may have some tooth soreness, and that's just because the orthotics fit the teeth perfectly. So all the grooves that are in your teeth, it's going to sit into those, and if it's off just a micromillimeter, it's possible it could make the tooth sore. Usually that will go away within 2 to 3 days. If it does not go away, or if it gets worse, or it keeps you from being able to wear your orthotic, you need to call so that we can adjust it. The other thing that may happen is you may have some muscle soreness, new muscle soreness you haven't had before, and it's because your jaw is going to be in a different position, so it could make the muscles under here or even your tongue may get a little sore. Your tongue is going to want to check everything out, so it's going to be very busy. So one of the things that you can do that's going to control that is to keep your tongue in the roof of your mouth. So if you take your tongue and you touch behind your front teeth, you slide your tongue up to the gum tissue, you should feel 2 little dots. That is where the tongue should rest. That should be its resting spot. So with the tongue there, I want for you to concentrate on just keeping the tongue on that spot and just kind of chant in your head so you'll remember, tongue on the spot, lips sealed, breathe through my nose. Tongue on the spot, lips sealed, breathe through my nose. That is going to keep you in that good tongue posture, which will keep you from wanting to lick and check everything out on your appliances. But also, when your tongue is up in the palate, you cannot clench as hard. So that way we can start to stop that clenching habit that you have as well. So when you start eating, you're going to start out with some soft foods, just so that you learn how to use the appliances. You're going to have to learn that they're thicker, so your teeth are going to come together faster. So you'll want to eat slowly so that you don't bang your teeth together. You will find that there are some foods that you cannot eat, but you'll kind of find those things as you start eating. But start out with some soft foods so you don't bite your tongue, so you don't bite your cheek, and so that you don't bang your teeth together. As you start getting used to it and you feel like you can add other foods, well then start adding normal table foods. Throughout your treatment, you are going to want to avoid anything that is hard, crunchy, sticky, or difficult to chew. So those things would be hard chips, like Takis, Doritos, Fritos. You can still eat chips as long as they're really thin, like Pringles, Lay's, those really thin type of chips. You can still have those type of things. No sticky candy, no now and laters, gummy bears, any of that type of thing. No hard candy as well, because it will break your appliances. You'll want to avoid things that are difficult to chew. Bagels, steak, anything that you have to really work to chew, you're going to be overworking your muscles, and we're trying to heal them. So try to avoid those kind of things. You won't be able to bite into anything. For one thing, your teeth aren't going to touch because there's going to be space between the front teeth. And so don't try to bite anything from the side because you're going to put your jaw in an awkward position, and we're trying to heal the joint. So don't be eating anything where you kind of go to the side. Everything should be cut into bite-sized pieces and then just put straight into your mouth. To take care of the appliances, literally just requires just using a denture brush. You're going to get a denture brush today, and just soap and water is all you need. So you'll want to scrub really well and actually visually look at your appliance and make sure there is no food or debris or anything that is left. If anything stays in your orthotic and it dries, it may not fit the same. So just make sure that it's very clean. If just soap and water, you want to freshen it up more, You do have a denture bath that you can use, and you'll get some effervescent tablets. You can just put some water in and just drop the tablet in and let it sit for about 15 or 20 minutes, and that'll freshen it up a little bit and make that a little better for you. Always make sure that it is in your case when it is not in your mouth, especially if you have pets, because they will want to eat them. They'll smell it and they'll actually chew it. And even if it's in your case, I've had patients bring their case and the dog ate through the case. So you want to try to keep it away from your pets as well. Now, through your treatment, your bite is going to change because there are changes in the joint. Do not be concerned. That's just a normal thing that's going to happen. But do not test your bite. These orthotics should be in your mouth 24 hours a day. The only time they should come out is to change them or brush your teeth. While they are not in your mouth, do not allow your back teeth to come together. There has been that space that's been created, and that's kind of the healthy space. That's where everything is healing. And if you put your teeth together, then you're going to enter into that healthy space, and then you could relapse. So make sure that you're not putting your teeth together. All right. It is possible that your orthotics will break, especially the day one, because you're eating in it. If it happens, it's not an emergency unless your bite changes. So if you get a little chip in your day one or something, don't be concerned. But if you put it in and you put your teeth together with it in, it feels different, then your bite's changed. So call immediately so you can come in and we can take a look and see if it's something that we need to repair or modify for you as well. If you ever have any questions, never hesitate to call. Usually someone at the front will know. If they don't, they'll come back and get someone from the back to answer your question. No question is a stupid question, so don't ever think this is so silly, I'm not going to call and ask. Just always call. Whenever you come in for your appointments, we'll be seeing you every 2 weeks now. Bring your appliances with you. Of course, you should have the day one in your mouth when you come, but bring your night one as well so we can check that as well. When you come in for your 2 weeks appointment, you'll be given a purple sheet and you're going to fill this out. This is going to ask you to circle where your pain is. So you'll just circle 0 through 10, 0, you don't have any pain. You're going to answer these questions and then we'll fill this out as well. But this was kind of our report card, so you'll fill that out every 2 weeks. So you're on your way to recovery, and we look forward to seeing you in a couple of weeks and wish you the best of luck.